Welcome to Afro Mosaic Health Guide magazine. In our year-long series, Impacts on the Global Black Lifespan Journey, we're tracing the entire path of Black life, from the very first breath to over 100 years.
Today, we're digging into a story that begins right at the foundation of that journey, pregnancy. We're going to be focusing on a critical issue in Nigeria, the intersection of hypertension and maternal health. Now, this isn't just about statistics. It's really the foundational story for the health of mothers, the strength of families, and of course, the well-being of future generations. So let's get right into it.
Okay, let's start with a number that, well, it really frames the scale of this crisis. 29%. Just let that sink in for a second. That's Nigeria's share of all maternal deaths across the entire globe. It's a truly staggering reality, and it's one that really demands our full attention. Now, let's zoom in on that number. Of those tragic deaths, nearly a third, 32%, are caused by just one thing: high blood pressure. You know, this tells us something really important. The primary driver here isn't some complex, untreatable disease, it's hypertension, a condition that is so often manageable and even preventable.
And this quote from a mother and Abuja, it just brings that reality right home. It's the raw, honest fear and the life or death stakes that families are facing. This is so much more than data points. It's about the very real lives of mothers and their babies.
So the medical term for what we're talking about is hypertensive disorders of pregnancy, or HDP for short. It's basically the umbrella term for conditions like preeclampsia and high blood pressure during pregnancy. And as we've just seen, it is the leading cause of maternal mortality in the country.
And that really brings us to the biggest question of all. If these conditions are so often preventable with good, timely care, why on earth are they still so deadly? Well, the answer isn't about the choices an individual makes, it's about the system itself.
And this is where we start to see the cracks in that system. Research has found that a whopping 65% of pregnant women with high blood pressure are only diagnosed after they're already pregnant. That means crucial opportunities for early screening were just missed. And once they are diagnosed, get this, only about 6% actually have their blood pressure under control. And it gets worse. Some women are given medications that are actually unsafe during pregnancy, while a simple, effective preventative like low-dose aspirin, it's not being used at all, 0%. These aren't just little oversights. These are major, systemic failures.
And this distinction right here is absolutely critical. On the left, you've got drugs like ACE inhibitors, which can seriously harm a developing baby. On the right are the medications like labetalol, which are proven to be safe and are the ones recommended in the national guidelines. The fact that any pregnant woman is getting a drug from that left column points to a really dangerous gap between what we know is safe and what's actually being done.
So why does this even happen? Well, a lot of the time, the clinics that are closest to the community, the first line of defense, they just aren't equipped to handle these cases. They're under-resourced, they lack specialized training, and that means women have to be referred to bigger hospitals. This whole process creates dangerous delays when time is absolutely critical.
And even when women do get access to care, there's another huge barrier: cost. Just look at this chart. It shows the shocking difference between the international target price for essential hypertension medicine and what patients might pay in Nigeria's public sector, sometimes up to 7 times more.
This isn't just an economic problem, it's a full-blown health crisis. That price gap forces families to make completely impossible choices between life-saving medicine and other basic needs, like food or rent. When it comes down to it, affordability isn't a luxury. It's a fundamental part of keeping mothers safe.
Now, I know after looking at all these challenges, it is so easy to feel overwhelmed. But here's where the story really pivots. These are solvable system-level problems. They are not inevitable. And the good news is, the work to fix them has already started.
And a really powerful sign of this progress is right here: the official national guidelines for hypertension management. This isn't just some document sitting on a shelf, it's a blueprint for change. It's a real commitment from the highest level to standardize care and protect mothers all across the country.
And these guidelines, they're being brought to life through some really smart strategies. Things like task shifting, which empowers local nurses and health workers to provide care, bringing it closer to home. Or drug revolving funds, which use bulk purchasing to slash medication costs. And standardized protocols, which make sure that no matter which clinic a woman walks into, she gets the same high standard of care. You see how each of these directly tackles a specific barrier we just talked about? So, this all brings us back to you. We've looked at the system, we've looked at the solutions that are being put in place. So how can all of this knowledge become a real tool for protection in your own hands? for you, your family, and your community.
Knowledge is such a powerful tool, and a lot of the time, it just starts with asking the right questions. So here are 4 to bring with you to your healthcare provider. Each one is designed to help close those gaps we've discussed. They cover screening, prevention, medication safety, and having a clear plan for that vital postpartum period, what we call the 4th trimester. Remember, your voice is an absolutely critical part of your care team.
And really, that's the main takeaway here. Being informed is a form of self-advocacy. Understanding what safe, respectful care is supposed to look like and feeling empowered to ask for it is one of the most powerful forms of protection you can have for yourself and for your baby.
So let's just recap the most important things to remember. First, these tragic outcomes are not inevitable. They just aren't. Second, they are the result of solvable system failures, not some kind of inherent biological risk. And most importantly, safe, respectful, and effective care is not a privilege. It is your fundamental right. So we'll end with this question to think about. We've seen that individual action is powerful, and we've seen that systemic change is actually happening. The path forward really requires both. So how can we, as a community, as advocates, as a country, build and sustain a system that is truly designed from the ground up to protect every single mother?
Thank you so much for joining us for this vital conversation. To keep following these stories and be part of the solution, please subscribe to Afro Mosaic Health Guide magazine and our series, Impacts on the Global Black Lifespan Journey. Your support and your engagement really do make a difference.